Hi, I am Dr. Prajwal K Rao, aesthetic and plastic surgeon working at Dr. Prajwal's Laser and Cosmetic Surgery Center at Kanhangad and Mangalore. Today we are going to discuss on gynecomastia, or most commonly called as man boobs. Gynecomastia is a condition where young males suffer from extra fatty or glandular tissue in their chest. Basically, it makes their chest look like a female chest. So, why do we see this gynecomastia in young adults or young males? Basically, the most common reasons are: one is the hormonal surge that happens in the puberty age, where there will be some changes in estrogen and testosterone levels of the males, and that can cause gynecomastia in the age group of 13 to 15 years of age group. Usually this settles by the age of 17 or 18 years, but if it doesn't settle, then we might need some treatment for the gynecomastia. The next common cause we see in gynecomastia is basically because of some protein supplements or some steroid tablets which usually the bodybuilders take during the workouts or gym or something like that, and that can also cause gynecomastia. Few other uncommon causes are basically maybe some of the drugs like medications can cause gynecomastia, some of the cancers of the testicular cancers can also cause gynecomastia in the older age group. But most commonly we see in our clinical practices basically the young males who is going through puberty age and get this gynecomastia which doesn't subside by the age of 17 years. So basically the treatment for gynecomastia. The treatment for gynecomastia includes only surgical treatment. There is no medicines for this gynecomastia. But yes, for the fat in the chest can be treated with some gymming activities, some exercises, some diet, and that can be helping out with that. But for pure gynecomastia where there is a glandular tissue which mixed with the fatty tissue, such tissues can only be treated with liposuction treatment. Liposuction is a keyhole surgery where we make a small access holes either in the areola or in the sides of the chest so that it is hidden. And once we make through these holes, what we do is we send some cannulas through which we remove this fat either by different technologies. Probably there is simple liposuction, there is a power assisted liposuction, there is a laser liposuction, there is ultrasonic liposuction, and so on. So with these technologies we try to remove the fat, the stubborn fat, the gland, we separate the gland and then we remove the gland through the areola access incision. Once this is done, after the surgery patient usually can go back home the same day. There is no downtime as such, but yes, there will be some swelling in the post-operative period. So what we do is usually the patient comes in the morning and goes back in the night after the procedure, and next day he can start his regular activities. For example, he can read books, he can do his regular activities like going to bathroom, brushing your teeth, cooking some food. This can be done the next day itself. But doing the lifting the heavy objects or going to the gym or working outs can be avoided for 3 to 4 weeks after the surgery. Usually after the surgery we give some compression garments. It is something like a jacket that helps to keep the edema in control and also to give the better shape for the chest. And these are the things which you should follow after the gynecomastia surgery. Few things what young adults should see that is that you should always abstain from alcohol, smoking, and avoid some bakery foods after the surgery so that your results becomes the best results after the procedure. Many of our patients ask us, when do we see the results after gynecomastia surgery? Basically after liposuction the results are instant, but because of the edema in the chest, the results may not be seen in the patient's immediate post-op period. So usually when we tell our patients, what we say is that 80% of your results will be seen at the end of 1 month and around 95% of your results will be seen at the end of 3 months, and usually the final results we see at the end of 6 months. The reason is that whatever wound we make, the wound healing, basically the scar formation, the scar modulation, the scar healing takes around 6 months to heal completely. So that is why we say that the final results of your surgery will be at the end of 6 months. And for some individuals, because based on the grading of the gynecomastia, there are grade 1, grade 2, grade 3, grade 4. The larger grades who has bigger gynecomastia tissues will be needing a secondary surgery probably in the later phase after 6 months after the first surgery. So these things you should keep in mind. And with this surgery, this is one of the commonest surgery we do in our clinical practice and one of the safest surgery. and with no hesitation the young individuals can go for this surgery. It is purely done under general anesthesia or sometimes under local anesthesia that can be treated very easily. To know more about gynecomastia and its treatment options and what are the technologies we use, you can always comment in the comment box below. We will be happy to help you out with the information for the gynecomastia treatment. Thank you so much.